Hi, my name is Leilani Othwafi. I am a dental hygienist by trade, and then I went onto the administrative side when I started in dental fraud analytics, and then predominantly spent most of my time there with just subbing a little bit on the clinical side. And I am bringing this case to you. This is a case that comes to us from Dr. Jeanette McLean. You can see her up here in the upper right-hand corner. I want to make sure to give her proper credit. She comes out of University of Nevada. And the reason I want to bring this case to the front first is because dental caries is the number one preventable chronic disease in America that affects, every person. And I don't think we spend enough time talking about all the treatment options so that we can make sure we combat this disease as effectively as possible. So how many of us have been affected, whether it's us or a loved one, with a smile like this? I know I have, and I know that transition from, even just natural teeth to this is quite traumatic. And I wanted to highlight some things to bring to your attention. When a patient like this comes in, right off the bat, we're going to take some radiographs, right? And this is how the radiographs appear on this patient. You can see the teeth. If you follow the teeth around, there's a nice border, and then right around here you can see this notch, and then there's some black in between, and then another gray notch in the tooth right there, and then follow it around. There's some a little gray notch there and there. It's not as prevalent, but then you follow the tooth around and you can see another gray notch there, and then another gray notch there, and then up. So in this case, the patient has a diagnosis of dental caries interproximal D through G. And the way that I would document that in the chart is to make sure that we document each tooth and each surface. And I know that that's quite cumbersome at the front end, but it pays off on the long run for documentation purposes and to be able to, withstand compliance and scrutiny as far as on the payer side as well. So if you can list the tooth and then list the surfaces and then comma and then list the next tooth and then list the surfaces, that's the best way to document it. At the very least, say dental caries interproximal D through G, if you have a really sophisticated billing system or biller who can look at the x-rays and interpret that for you. The treatment that I want to talk about that I don't think we talk about enough is SDF, which is short for silver diamine fluoride. Silver diamine fluoride is a liquid fluoride that is used for the treatment of dental caries. This arrests or stops the dental caries at the very least. It can heal the tooth, but at least it's going to stop it from getting worse. This is especially helpful for pediatric patients, which is why Dr. McLean is bringing this up, and it's a conservative alternative to a traditional filling or stainless steel crown or other crowns. It is applicable for adults and pediatrics, but again, it's most beneficial for pediatric patients because, doing anesthesia and some of these papoose boards as far as behavior management leads to a lot of dental trauma and puts people in an anxious state when they come to the dentist, and that's not what we're trying to accomplish. And I think this is a really good approach to help soften that up a bit. So again, if you come over to this tooth here, I'll talk about SDF on this picture on the upper right hand corner. Okay, so SDF is a liquid fluoride. It's applied with a paintbrush on the dried tooth surface. And it is the big con of why this isn't talked about, every time you come in, is because healthcare providers assume that the cons are going to outweigh the benefits for a patient, and they don't even spend any time on it. And so the con is that when you dry the tooth and paint this just on the tooth, then it permanently stains the decayed tooth. So yeah, it makes the decay really evident while it's healing. And so that is the biggest con. If it gets on the soft tissue for like 1 to 3 weeks, it'll stain the soft tissue, but that will come off. But on the tooth, for as long as that's decayed and it hasn't healed, it's going to be black. Okay? And how it works is it is painted on, penetrates the tooth structure. It's antimicrobial, so it kills the bacteria. It increases the mineral density and hardness because it has this healing compound in it called fluorohydroxyapatite, which is just a really fancy name for, basically trying to heal that tooth. And then it seals up the little tubules that you see on a microscopic level on the tooth. And so that's how the mechanism of action works for this product. It requires application generally every 6 months. You want to reapply it until the area is sufficiently healed, or if it doesn't work, then you may need to step to a filling, but it's the first line of defense. If you are a patient that is allergic to silver, this is not a good option for you. A dental hygienist can apply this in all 50 states. It just depends on the level of supervision within that state, whether a doctor needs to be in the office, or the supervision guidelines for the doctor that is recommending overseeing the treatment. But in all 50 states, this is a viable option. It is the standard of care. It's been established as the standard of care by the American Dental Association for many years, and it's not talked about. The price ranges anywhere from $20 to $75 because it depends on how many teeth need to be treated. It's often covered by insurance, especially for children, and even Medicaid often reimburses this. This is something that insurance companies feel so strongly about that they come out of their own pocket to cover this because they know it saves in the long run. For billing purposes, you're going to want to bill code D1354 on the dental claim, or CPT code 0792T on a medical claim, and that is a per tooth basis on these codes. Okay, this is not to be confused with a routine fluoride gel or varnish that's applied when you come in for your cleanings, generally, that are administered on a preventative basis. That's D1206 or D1208. This is completely different. It's not preventative. It's already happened. The decay is there, and we're trying to treat it. So that's the difference in the fluoride varnishes. This is not ingested. So a lot of the misinformation out there about fluoride and everything like that, if it's swallowed, and no, it doesn't apply. This is simply painted on the tooth. You can see on the case here where it permanently stained. These teeth, the laterals here that you can see on the side. You can't see it too much on the E and F, but it's behind, but you can see there what that looks like once you paint that on. However, after multiple applications, this was the outcome for this patient. This is a possibility. And altogether, this 20-month-old patient was able to avoid general anesthesia by going with this method of silver diamine fluoride. The supportive documentation that you're going to need is radiographs. There's also notes that are possible if you just put it into your notes. And then if you have a photo like Dr. McLean has, that's great as well. But the radiographs and the notes should be sufficient. Again, this is a procedure that insurance companies are motivated to reimburse. They understand the benefits of it and how cost effective it is for everybody involved. So I don't see them giving too much of an issue about it. It is a per tooth code. So it doesn't matter if it's on the mesial surfaces and on the distal surfaces. You want to list that out because your diagnosis is key for demonstrating, the patient's condition, no matter what treatment the patient opts to go for. So you're still going to want to document how many surfaces, but that's not going to affect the reimbursement rate because this is a code that is billed out on a per tooth basis. It should be listed on the claim as a per tooth basis, and then when it's submitted to the insurance company, they will, bundle that up and then reimburse it on a per arch basis or whatever, and that's just going to be specific to each plan. But again, the best way to list it on the dental claim is to just list it on a per tooth basis. Okay, so I hope this helps you to be your own best advocate, to reduce healthcare costs and hold on to as much of your natural tooth structure as possible. Don't forget to subscribe or follow if you like this content, and if you want to submit radiographs for a case study, then please email that to support@rowofire.org. Thank you guys for joining me. Love you. Bye.